So we've got Dr. Wendy McDonald here with 3 topics that all women should be talking about. But before we get started, we have to let you guys know that the content we're about to discuss, it's for a mature audience. So maybe get those little ones out of the room and let's get to it.
Yeah. So, Dr. Wendy, we've all heard of the HPV, the vaccine and everything, and we've heard of the virus that can, the vaccine that actually helps prevent you from getting it.
That's right.
So is this something that we should be doing, or what exactly is it? Just break it all down for
I'll
us.
break it down for you. I'm ready for this. So HPV is a virus that is sexually transmitted. It stands for human papillomavirus. The problem with HPV is it's really often asymptomatic. Most people do not know that they have it. Most people will not know until they either have an abnormal pap smear or like genital warts. The ones that there's different strains, and the more high-risk strains are the ones that can cause cervical cancer. They can cause precancerous changes on the external skin of the vagina. They often don't cause a lot of issues for men, but the problem is men can transmit it. Exactly.
And I thought this was a teenager vaccine that you get, but you're saying
But in October, actually, the FDA approved the vaccine up to the age of 45 for men and women.
Oh, I didn't know men could get vaccinated.
Men and women, yes, because we know that
they never talk about that.
Right. But the strains that the HPV vaccine covers, it actually can prevent that HPV virus from transmitting up to 100%.
Ooh, okay, that seems like a smart thing to get. What are some of the symptoms or side effects of the virus?
Well, unfortunately, a lot of times you don't have symptoms, you just get the abnormal pap smear. But if you see lesions or growths down there, that's definitely worth kind of seeing your doctor and maybe even getting biopsied to see if it's a genital wart. But a lot of times the virus that leads to cervical cancer or precancer, you don't know that you have it unless you have a pap smear or pap test.
All right, next topic.
Okay, so let's talk about vaginal probiotics, right? Tell me all about these. We see some of these things for vaginal health on the shelves, but do they actually work? Are they actually good for you?
Probiotics are so commonly seen in drugstores, grocery stores, Amazon, but not all probiotics are made equally. A lot of probiotics are used for people to kind of improve their GI health, make sure their bowels are moving better. And the data is kind of not so great about whether or not that even really helps to improve your bowels, but if your symptoms are better, great. But for your vagina, there are actually only 2 strains of probiotics that we know can help kind of keep, yeast infections down, bacterial infections down. There are only 2 that we know, when you take it orally, it actually transmits to better vaginal health.
So is it just a general probiotic, or is it a women's probiotic?
So there are 2 specific ones that you can actually find, and I put them on my website on dreverywoman.com because there are actually more than 2 brands, but there are 2 actual bacteria strains of bacteria that different specific probiotics have in them. So you want to look if you're going to use a probiotic, you want to look for ones that have those particular bacteria.
That's really
strains.
helpful to know.
Okay, we got to get to this last topic, you guys. It's a little controversial, but this is my first time hearing about this. Medical marijuana for cramps or endometriosis.
Right.
What, how?
So we know marijuana can help with pain because there are definitely medical uses for pain management, cancer treatment and that kind of thing. Yes. Endometriosis can lead to really severe cramps, specifically usually around your menstrual cycle, maybe not, but oftentimes around that menstrual cycle. The data shows that some of the same pain receptors that come from endometriosis can be affected by cannabinoids. I can't even say the word, marijuana, let's go there. They can actually help those specifically, those pain receptors.
How is this administered? Is this a pill or an insert?
So
it's an insert, right?
The science is still being developed because the question is it going to be something that you take orally? Is it going to be something that you put in the vagina? The 2 may work the same, especially if you're using those specific receptor targeting marijuana. So how we administer it, we're still trying to figure that out, but it definitely has promising,
Will it get you high?
Well, that's the thing. We try to take out the part that gets you high. The part of the marijuana. Well, that's what the science is trying to do.
Are you accidentally going to be
That's what the science is trying to do, is to try to specifically target the part, the part that improves pain, and take out the part that leaves you high.
I'm curious to watch this. I like natural stuff. I like the idea of doing something like this versus taking a pain pill.
I wouldn't be surprised if within the next year we have some actual science
evidence
and products.
Yeah.
Interesting.
No, that's a really good way to look at it. Hopefully it can help some people.
Thanks for telling us all about this stuff. It's fascinating.
Thank you.
Yeah, you can follow Dr. Wendy and read some of her latest blog posts on her website, dreverywoman.com.